from Trobe University, and the second speaker, Inge Dhamanti, Ph.D. Thank you very much for joining today and your sharing experience later. Before we go ahead to hear the presentation from two speakers, let me introduce myself. My name is Navika Yamani. I am a lecturer in Faculty of Public Health, Universitas Airlangga. Today, I will be host in this webinar, and I will inform all of you, the participant, during the presentation. All of you can ask the question, and please write down in the chat rooms whether the participant who are joining in the Zoom, you can write down in the chat rooms in the Zoom, and also the participant who are joining in the live streaming YouTube, you also can write down your question in the live streaming YouTube. And this webinar is divided into two sessions. The first session, we will hear to the presentation, or maybe also sharing the experience from two speakers, two outstanding speakers. And the second session is open discussion. We will collect and read your question from the chat rooms, and we can get the feedback from the two speakers. Okay, we go to the first session now. I will invite the first speaker before starting the presentation from the first speaker. Let me introduce the first speaker briefly about the curriculum vitae. Her full name, wait a moment, I will share screen. Okay, her full name is Dr. Hanan Khalil, B.Pharm, M.Pharm, EECPA, Ph.D, and she has education experience. She graduated with a bachelor degree in pharmacy from Victorian College of Pharmacy, Monash University, 92, and she got a master degree from Faculty of Pharmacy and Pharmaceutical Science in Monash University, and lately she got a Ph.D. degree from School of Pharmaceutical, Molecular and Biomedical Science in University of South Australia, 2002. And she also has the job position right now. She is Associate Professor in Trobe University, and she is as a consultant pharmacist, and she is also editor-in-chief in International Journal of Evidence-Based Healthcare. And she got some award here, and she has many publications, more than 100. So I think interesting to hear the presentation from the first speaker. Okay, I will invite the first speaker, Dr. Hanan. Time is yours. Thank you.
Thank you very much, Laura, for this lovely introduction. And I'm very delighted to be here and to share my talk about scoping reviews. So just to let you know, I've been working with a group of experts, knowledge synthesis experts from around the world, from Australia, America, Canada, and South Africa, in developing a methodology about scoping reviews. We've published the first methodology in 2015, and then we've updated the methodology in 2017 and this year. So I'll talk you through the scoping reviews methodology. This is a methodology that it's a type of systematic reviews, and it has become very, very popular. The methodology now has got a citation in Google Scholar has got about more than 1,500 citations of the methodology that we've published. It has been highly taken up by researchers, and it's sort of an easier way of doing a systematic review. And I'll talk you through what the methodology is about. So to date, I'm sure all of you know that there are more than 10 types of knowledge synthesis methods or reviews methods. So sometimes it's a little bit difficult to find out which one is best suited for your research question. So I'll just go through some examples first of what some of these are. So there is an umbrella review, or Cochrane calls it overview of reviews. And this methodology is very useful when you've got too many systematic reviews on one particular topic, and you want to collate all the evidence that's from the published systematic reviews into one review. So that's why we call it an umbrella review. It combines the results of all the reviews into one review. And again, I've been involved in developing this methodology, and I'll be happy if people are interested to give another presentation about this if it's going to be useful. The other type of reviews is rapid reviews, and rapid reviews have been evolved because of the nature of increasing the number of primary studies in the literature, increase the numbers, and sometimes you want to do a quick systematic review, and without taking the time that's necessary to do the systematic review. So normally systematic reviews take about 12 months to finish. Or sometimes if you're really focused on them, they take between maybe 9 or 8 months to 12 months to finish. Rapid reviews take a lot less than that because they don't include a lot of, they cut on some of the steps of systematic reviews. So they could only include the last 5 years of research or the last 3 years. They could skip on the critical appraisal step, and that's why it's called rapid review. It's generated rapidly, and due to, for example, government demands, or during the COVID situation, we found that a lot of reviews have been published, and some of them have been rapid reviews because of the demand of policymakers and researchers needing to publish their results. Systematic reviews, that's a type of systematic reviews that we're all very familiar with, and it's there's many methodologies of systematic reviews published by the Cochrane, other methodologies by groups of researchers, and also Joanna Briggs Institute, that they've got their own methodology. Meta-analysis, as I'm sure many of you are familiar with. So meta-analysis is an extension of a systematic review where you actually combine the studies of the size effect of many studies to just combine them into one size effect, and you apply statistics to that to generate meta-analysis. There is also another term that you might be familiar with in the literature. It's called a network meta-analysis, and you can find a lot of reviews now published network meta-analysis, and that's really for reviews that combine more than one intervention. So instead of, for example, looking at the effectiveness of drug A versus drug B, so maybe in a network meta-analysis, you are interested in more than one drug. So combining 2 or 3 drugs together and wanting to find the efficacy of these. Prognostic reviews, obviously they are reviews for the future, and they talk about, wanting to know, say, survival rates or outcomes of a particular treatment, mortality rates, maybe morbidity rates, so things like that you would like to know that's happening in the future. Diagnostic reviews, obviously the name says it, so it's about diagnostic criteria, so whether a particular test is better than the other, or what you can use to diagnose conditions. Economic reviews, so economic reviews to do with cost-benefit analysis, and there are published methodologies for economic reviews. They faded a little bit from the literature. I'm trying to do economic reviews, but JBI has got a number of methodologies looking at a number of reviews, and economic reviews is one of the methodologies they look at. But because of the most of the cost-benefit analysis are done based on money, and it's obviously with the money rates, it's changing all the time. So it's hard to ensure that an economic review is really up to date and it's taken by government or policymakers. However, it does have a value in for many research questions. Integrative reviews are, again, another type of reviews, and they sort of include many types of evidence. So for me, when I think about integrative reviews, they're more like a systematic literature review, old-fashioned literature review. So you can include primary studies, you can include reviews, you can include any type of evidence that you want, but it's done in a systematic way. Qualitative reviews, it's something that Cochrane has started to put together, and JBI, or Joanna Briggs Institute, has published a methodology for qualitative reviews. And they're becoming very popular now because of the many primary studies that are published on patients' experiences or consumer experiences about a particular condition. And they do have a place in patient care and decision-making and quality of care as well. So they're good types of review if it does suit your research question. And the final thing, which is scoping review, which is what I'll be talking about for the rest of the presentation today. So as you can imagine, I've talked about maybe 11 types of different reviews now. So which one do you choose? Sometimes it's really difficult if you don't have much experience with many types of reviews. It's hard to choose which one depending on your research question. So a colleague of mine, Associate Professor Inge from Canada, has developed a tool to use, and it will help you to choose which type of review you can do. It will ask you a few questions, and you need to put it in there, and it will come up with a few options for you to choose which type of review is suited for you to come out to do. It might be very useful for students who are doing PhDs or masters on systematic reviews and wanting to know which type of reviews is suited most to this one. Okay, back to scoping reviews. Now, scoping reviews are normally exploratory projects that map the literature, and that's why they're called scoping review. So you scope the literature about a particular topic, or you map the literature on a particular topic. Scoping reviews help you to identify key concepts, theories, source of evidence, and gaps in the research. So they're not really to do with effectiveness, but they are really giving you a good map about the research, what's been done in the research topic or research question that you're after, and where the gaps are. So think about it as a map, as a tool to visually put together what has been done and what's missing in the literature. And that's why it's becoming very, very popular, particularly for researchers who can't define quite exactly what they want to do. So they do first scoping reviews, find the gaps, and then they can do, and then this can help them to identify a good research question to work on, or a good for either a primary study or for a systematic review. So different terms in the literature have been used to describe scoping review. So you might find when you look in Google Scholar or Medline, you'll find that scoping reviews have been also called scoping studies, rapid scoping reviews, scoping exercise. So different terms that you can find in the literature in there, or systematic scoping review as well. Okay, so what's the benefits of doing a scoping review? Now, it's a precursor to a systematic review. So as I mentioned before, ideally you would do a scoping review first before you want to do a systematic review, because you want to map all what's out there first in the literature and then come up with a good research question about the gap that you can find. It does identify types of available evidence because it's a mapping exercise and you can include any types of research in there. So it can actually tell you that, you know what, there is only a couple of systematic reviews on this topic. There is 20 RCTs on this, 10 observational study on that, but only a couple of case studies on this. So it can help you to identify what sort of available evidence is out there. It can also identify and analyze knowledge gaps. So as I mentioned before, because you're doing a mapping exercise, so you can visually see what's actually missing from the literature. It does clarify key concepts and definitions in the literature. So many times when I've actually done quite a number of scoping reviews, systematic reviews in general, but in particular scoping reviews. And many times after finishing the scoping review, you actually decide that, you know what, this particular term that I've been looking for is not very clear in the literature. So the term, say, medication safety, or the term, say, medication safety programs. Now, we call it in Australia medication safety programs. In Europe, it could be called pharmaceutical care programs. In America, it can be called something else. So it actually clarifies the concepts that you are looking for, and it can narrow down the terms that you can use for systematic reviews. Number 5, it also examines how research is conducted on a certain topic. So it does give you a good map about what's actually happening and how research is being conducted and how much research is actually being done there. And it does identify key characteristics or factors related to a concept. So I'll show you later on about how you can present some of these findings visually, but it does actually, you can form a good concept map about what you find and relate it all together and see how each question is related to the other, or each term can be related to another. So that's just another continuing slide about the benefits of scoping reviews. Now, not all of us do clinical research. Some people like to do policy research. So I work in a public health department, psychology and public health. And obviously, as you can imagine, with public health, they're really interested in policies and around the countries. And scoping reviews are very useful in developing policy maps. Mapping policy documents and research studies were previously undertaken by some authors. Both of them use scoping review methodologies. Now, because scoping reviews methodologies are really good because they map what's happening out there, so they actually been very good in methodology to go through some policy maps. So in general, systematic reviews have more research questions, whereas scoping reviews, they've got actually a much broader question. So I'll give you a little bit, a few examples in the next few slides about different systematic reviews, and we'll go through and to say which ones are suited for scoping reviews and which ones are suited for other types of reviews. Now, as a summary, scoping reviews are more exploratory in nature, whereas systematic reviews in particular, those with meta-analysis or network meta-analysis can be explanatory in nature. So they explain what's happening. They give you effectiveness. They answer effectiveness questions. They answer questions about prognosis. They're more of prognostic factors. So more of an explanatory nature, whereas because scoping reviews, they normally map literature, so they're more exploratory in nature. Now, so far, there are 3 different methods that are available for scoping reviews, or 2 mainly methods that I'm familiar with that are available for scoping reviews. So the first one, it was initiated by Aski and O'Malley, and you might find this in the literature. It was initially published in 2005, and then it's been updated in 2010 by 2 other researchers. By a group of researchers. Now, the second method that's been published in 2015 by Joanna Briggs Institute, and this is what I've been involved in. It's been updated in 2017 and now updated again in 2020. And there is the PRISMA scoping review, which is published in 2018. it's really an extension of the JBI methodology, but it puts a framework on it. It gives you a checklist of what you need to go through when you publish a systematic review. So I'm not quite sure exactly which methodology of scoping reviews you're familiar with. So I know some of you, I don't know, when I ask these questions in my seminars, many people are familiar with the first methodology. The second methodology, because it's quite a recent methodology, so not many people are familiar with it. But I do have some references at the end here that you can take a picture of if you like, and about the actual methodologies. Okay, so this slide represents sort of the steps that are involved in scoping reviews. So the first one, it's protocol driven. So you do have a protocol development, then followed by searching for relevant studies. Then after this, you go through study selection, then charting. We call it charting the evidence. Now, once you put together the evidence, there's no risk of bias appraisal, and that's why it's slightly shorter than in systematic reviews. For a systematic review, you need to actually critically appraise all the studies to ensure that they are good enough to be included in your systematic reviews. And then there is a data synthesis in there. And in your data synthesis or in your results and discussion section, in there you would explain your results, but also you have a section about implementation for practice and research. Now, so scoping reviews normally they don't have a section for policy and practice recommendations because the studies are not appraised. However, you can inform practice about what's available, but you can't really inform policy because there is no, you can't really put a grade on the evidence in there. So this is one of the steps that are missing in scoping reviews. So if you look at a snapshot of the differences between, the normal literature review that some people still publish today versus scoping reviews versus systematic reviews. Now, when we look at the requirement of having a protocol, now we all know for systematic reviews, you must have a protocol. Otherwise, your systematic reviews might be biased because you keep changing your results depending on what you find in your search. Now, with the methodology that I've published with JBI group, we do advise to have a protocol, a scoping review protocol, and that's again to reduce the publication bias. Traditional literature reviews don't have any protocols. When it comes to registration, now traditional literature reviews, they're not really required to be registered in Prospero. Scoping reviews are not or cannot be registered in Prospero. However, they can be registered into other websites, and I'll show you in the next few slides which websites to register your scoping reviews in. Systematic reviews, they definitely need to be registered in Prospero, and also you can publish them. Now, I'm aware, being an editor-in-chief of a journal, it's really hard to publish protocols, and the reason being because they're not very highly cited. And they probably be only cited once, and that's in the final review. And given that sometimes reviews don't get to be finalized or published, so most of the time they actually don't get cited at all, the reviews. Sorry about that. So it is hard to have a scoping review published. However, scoping review protocol published. However, you can definitely register it in a open frame or Figshare, which I will show to you later on. Now, once, and it's always when you register your protocol, you've got a good chance for it to be published. However, when you've got a review that's not, that has got a protocol that's not registered, then it's actually the chances of it being published is quite small. Now, moving on to the search strategy. So obviously scoping reviews and systematic reviews, both of them have got a transparent peer review strategies, whereas traditional lit reviews, they don't. They can just, it's just as you may know, some of them don't even explain the methods of search strategy that they have undergone. Standardized data or extraction forms. So the lit review doesn't have any of that, but whereas scoping and systematic reviews, both of them have got extraction forms for their data. Risk of bias assessments, so only the systematic reviews have got that, which I've already talked about that. And the synthesis of findings from individual studies or summary of findings. Obviously, this is only relevant to systematic reviews, but there is nothing like this for scoping reviews because there is no critical appraisal, so we cannot synthesize any findings. However, we only chart the findings or map the findings. And I'll show you different ways of mapping the findings, and that's what the updated version of the scoping reviews methodologies that we've published. The difference between 2017 and 2020 version, it was based on giving the researchers ideas about how to chart their findings, in addition to other small updates. So I just want to talk a little bit about the guidance, which is the 2017 and 2020 for the JBI. So we've got a Prisma for scoping review. It's now available and it's used for, it's like a good checklist to make sure that you've actually following a good methodology. Scoping reviews now can be registered, the protocols. And we've, in the 2020 guidance, we've provided emphasis on presentation of the results. And we've got clear guidelines on what a scoping review is, what it can and can't do. We do have an emphasis on the fact that you cannot use them for policy or practice recommendations because they don't have the critical appraisal step. Okay, so I'll take you through the steps of how to do a scoping review in the last probably 10 minutes so that's left. So obviously you need to start with a protocol, and a priori protocol must be developed before you actually do the scoping review. And these are the two websites that I mentioned to you before. So we can't register them in Prospero because Prospero only registers systematic reviews, whereas Open Science Framework or Figshades, both of them, they do accept scoping reviews registrations. Now, the good thing about having a protocol-driven scoping review is that it provides a plan and it does limit your reporting bias. It also makes sure that you don't deviate from the methodology. And if you decide to change something because your results didn't match the research question, you can actually include it in your final review and you say, this is not consistent with the scoping review based on the findings of the searchers. So, and you can be quite transparent about it, which is obviously very reasonable. Now, the next step that I'd like to talk about is actually how to develop a scoping review question. Now, obviously it does assist in developing the protocol. It guides and directs the development of the specific inclusion criteria. So once you've got a good, clear scoping review question, you will end up obviously refining your inclusion and exclusion criteria. Now, it does obviously, once you have got a good question, it does facilitate the lit search and the terms that you could use, the synonyms, so that you can have a specific but also inclusive search strategy. Now, obviously for a systematic review, everybody is familiar with PICO, which is participant, intervention, comparator, and outcome. For a scoping review, we use a different mnemonic altogether. We use a PCC. So P stands for participants, C for concept, and the other C for context. And I'll go through each one of these in the next few slides. So normally for a scoping review, you will have a big overall question, but you can have a sub-question as well to outline how the evidence is likely to be mapped. So I'll talk a little bit more about that with examples in the next 2 slides. So I just want to give you just a bit of explanation about what do we mean by the mnemonic in here. So the PCC. So Okay. So P for types of participants, and it's important to think about your participants in there, and you need to detail your, age, gender, any criteria that you'd like to include in there, exactly like systematic review. Now, the concept is a little bit different. So think of a concept as intervention. So the core concept examined by the scoping review should be clearly articulated and to guide the scoping review, breadth and inquiry. So these may include details about the elements that you want to question, and that would be detailed in a standard systematic review, such as the intervention. So think about it as in sort of, this is your intervention or phenomenon of interest, or the outcome as well. Now, the context is the last one, and the context for this one here is the element of a scoping review, which will vary depending on the objective. So the context could be things like cultural factors, geographic location, specific racial or gender-based interests. In some cases, it could be things like your setting, whether you're interested in hospital settings or primary healthcare settings or community settings. So the context usually it's not the concept. It's really about the place. It's about cultural factors, things that you can't include in either the participants or the concept. Now, the source of evidence, the source of information can also include any existing literature. Now, we know for systematic reviews, say for quantitative systematic reviews, you can include only, say, randomized controlled trials or observational studies or case studies, depending on the research question. For a scoping review, you can include any type of studies that you can. So you could include things on, you can include actually reviews, systematic reviews. You can include case studies. You can include editorials. You can include thesis. You can include anything as long as you are very transparent and upfront with it. You can also leave source information open to allow for all types of sources or choose to limit sources. So you can say peer-reviewed and non-peer-reviewed. We know systematic reviews, they are only, or mostly they are restricted to peer-reviewed articles, whereas scoping reviews, it can include both. I just want to give you a couple of examples of scoping reviews that I've been involved in. So the first one, it's just example. So what are the most common adverse drug reactions experienced in primary care and the classes of drugs associated with them? So this is, remember how I said earlier on that you can have a big overall question and then underneath it, you can have two specific questions. So this is my big overall question. So I'm interested to know, being a pharmacist by background, I'm interested to know the types of adverse drug reactions that are experienced in primary care. So when patients go and visit their GPs, I want to know what sort of adverse events they are reporting to their GPs, and I want to know which classes of medications are associated with them. This is actually a systematic review that I've published a year ago or 2 years ago. And I was interested mainly on, so the two sub-questions that I had for this particular scoping review, I was interested, number one, in the types of drug reactions. So we know that the types, there is type 1 and type 2, or there is idiosyncratic adverse drug reactions. So there was 3 different types of drug reactions that patients can experience, and I was interested in all 3 of them, and which ones are more experienced by patients than others. My second question or sub-question, I was interested in which drug classes are associated with more harm than others. So that was the first scoping review question that I've got here on the slides. Now, the second research question that I had, which was very suited for a scoping review, again, that was published a couple of years ago. I was interested in the characteristics of medication safety programs in the primary care. So this is a very open question, and even medication safety program can mean different things to many people. Now, we know that to reduce medication errors and adverse events, many hospitals have got interventions to reduce that at different points of transition of care, or different points of care anyway in hospitals. So I was interested in programs that have got more than one intervention. So things like this. And I wasn't necessarily interested in the effectiveness of these programs, but I was interested mainly in what sort of programs are there. So for example, there are programs that are run by nurses, programs that are run by doctors, programs that are run by multidisciplinary teams at different points of patient's care. So this is really what I was interested in. And I was interested in mapping them. And that was only in primary care. I've done another one in hospital, but this really was about the primary care. So with the primary care, so there were things that were done at the pharmacy level as well, where people were going to get their medications and so on. So as you can see, these two examples, they don't really fit a normal effectiveness systematic review. It's more about scoping exercise or a mapping exercise. Now, some people may be familiar with mixed methods reviews. So what is the difference between a scoping review and a mixed methods review? Now, I mentioned earlier on that scoping reviews can include any types of research studies. So it can include qualitative studies, it can include quantitative studies, it can include editorials and all the rest of it. Now, we know with mixed methods, they're only relying on, you will have a big research question and two specific questions, one of them really specific to a quantitative measure and the other one a qualitative measure. So the question that I have here at the end here, that is actually a mixed method question. So it's called, the example is, what is the effectiveness, cost effectiveness, accessibility, and implementation that includes barriers and enablers for chronic kidney disease management programs for Aboriginal and Torres Strait Island Australians. That's actually a systematic review that's been published. And that was a mixed methods research, systematic review. So as soon as it talks about acceptability, so you know that's actually talking about patients' acceptability or healthcare professionals' acceptabilities of these management programs. Cost effectiveness, obviously it's an effectiveness one. So this systematic review, if you want to go and look it up, it does include both qualitative and quantitative evidence. And as you can see from the research question, it's not about mapping, it's really about effectiveness. So that's just an example. And I'll give you a few examples later on about the difference between what are mixed methods and scoping review. So I've got a list of about 8 or 9 examples of scoping or mixed methods review. And I'd like you to think about which one of these. Might be a little bit hard now because we've got about more than 70 participants in here. So we'll go through it. So the first one is an these are all published in the literature and you can look them up once we finish. But the first one is Organization and System Theories in Interprofessional Research. Now, sometimes the title doesn't give you very much about what the research question is. But from what you can gather here, obviously it's a very broad question. It's not about effectiveness and it's not really about prognosis. It's not about prevalence or none of that. So actually this is a typical example of a scoping review. So if you look up this topic, it's actually a scoping review that's been published in the literature. Now, the next one is assessing patient experience and health quality of dental care using patient online reviews in the United States. Now, for me, again, that's only a title, and sometimes titles are misleading. But as soon as you see patient experience, I would go straight away for qualitative research. So this one could be an example of a qualitative systematic review. Not so much scoping review, because with scoping reviews, it's more broader than this. Now, the next one is discussing sudden unexpected death in epilepsy with children and young people with epilepsy and their parents and care. Again, anything to do with discussion, anything to do with patients' views or health professionals' views or carers' views, it's more likely to be qualitative systematic reviews. Now, the next one, it's a title, Mapping Palliative Care Research in Australia, which I've published earlier this year. Again, it's quite broad, but this is an example of a scoping review. Now, and you can use this for different types of research questions. Now, what I was interested in this one, it was really to do with my research collaborators. I wanted to come up to see what palliative care research was not done in Australia. There was many studies published on cares, on patients, on quality of care, on visits to patients. But I wanted to map them up and see where the topic that was least studied in Australia, which topic hasn't got many research studies in there. And this is something that we can actually start working on and publish in. And that was a very useful exercise for me, because if you want to have a screenshot of this and read the published article, but I've put in a map or one of the graphs there presented the number of studies that was published every year, but also the topics. So I found that after hours and emergency care there wasn't many studies published in that area, and that's an area that we can look at in the future. So you can see that it's actually, scoping reviews can be very good to determine which area you would like to publish in. Now, another example that I have for you here is occupational stress facing nursing academics. So this one was a mixed methods research, because it's a very open, it's about occupational stress, which is really something quite specific, but it lends itself to a mixed methods, because you can look at both effectiveness of the strategies for occupational stress, but you can also look at the patients, the nurse academics experience about occupational stress. So that was a mixed methods research, a systematic review. Now, this one here, risk factors for completed suicide among people who use drugs. Again, that was an example of a scoping review. And it did map the risk factors that were involved in that particular topic. Moving on, physical functioning limitations and physical activity of people experiencing homelessness. Again, that was a scoping review, an example of a scoping review. And I do know that, sometimes it's really hard to know from the title what sort of a review from the title, what sort of review it is. But when you look closely, you can actually sort of guess some of this research question. Now, the last one again was a scoping review, and it looked at the quality of life questionnaires that were available for pediatric patients following tonsillectomies with or without adenectomies for chronic infections or sleep disorders. So again, that was another one, another example of a scoping review. Now, I want to take you through the other steps. So we've already talked about the protocol. We've talked about how to refine your research question using a PCC. Now we want to talk about the search strategy, which is exactly the same as a systematic review. So normally when I do a search strategy, I do it in 3 steps. The first one, you do an initial limited search in maybe 1 or 2 databases, and this is to pick up all your search terms. Once you pick up all your good search terms that the studies that you are interested in are citing, you can use all these search terms in your second step to do in all the included databases that you want. And once you do this and you have a clean copy of your included citations with no duplications, put in EndNote, you can look after this in the reference list of the included studies in there. So this is how I normally would do my search for any systematic review. Okay. Now, once you do this, again, in scoping reviews, we use a Prisma chart, exactly the same as a systematic review. So you do need to represent records identified through the different databases, anything that you have identified through hand searching or anything from your included studies, combine them in there, get rid of all the duplicates, you screen them, you get rid of all the ones that are not relevant. The ones that are relevant, you have a look at the full text articles, and then you include whatever is necessary in there. And then you've got the final ones there to be included in your scoping review. So same as a scoping systematic review. Now, as I mentioned before, we don't do risk of bias. There is no critical appraisal of any sort. So you go on to do the data extraction straight away. So the data extraction needs to be thought of in your scoping review protocol, and you need to think about which data am I going to extract so that it can clearly answer my review question. And the data extraction, you need to think about charting a table or a form should be developed and piloted at the protocol stage. So many times when I do scoping review, I have an initial plan of what the data is going to be extracted and what's going to be look like, and you are allowed to change it once you have your full scoping review, and you can keep adding to it. But you need to have an initial thought about what the data is going to look like and how you're going to chart it. It's exactly like a systematic review, you need to keep track of each data source and keep track of all the citations and exclusion and inclusion. Now, when you come to analyze your evidence, now we don't do any synthesis. So unlike systematic reviews, there is no synthesis. It's only charting or mapping your data. Now, what you can do, you can have a qualitative content analysis, and it can be descriptive. But if you decide to do a qualitative analysis, so presented by, say, different concepts that you found, we actually don't recommend thematic analysis, because thematic analysis is really a part of qualitative systematic reviews, but you just present it as a narrative approach or a narrative way in your scoping reviews. Now, data analysis is dependent on the purpose of the review and the author's judgment. So it's very dependent on what your research question is and what you would like to present, or what sort of data is going to help you to answer your question. And I'll show you in the next few slides about how to actually present your data. So at a minimum, when you present your results, as I mentioned before, you need to have a plan about how you're going to present it. A table is probably good enough in the protocol stage, but at a minimum, you need to include the year or period of publication of your included study. Countries of origin is good because you want to know whether all your studies have been published in Europe or in Africa or in Asia. So it's good to have this parameter there in your results. Area of intervention and research methods as well, whether it's quantitative, qualitative scoping reviews, because it does give you a good map of what's happening in the literature around your topic. Now, some more categories you can add. You can add your intervention type. You can add something about your population, the aim of the paper, methodology adapted, and key findings, and so on. So it depends. This is just only suggested format, but you can include whatever you think in there. Now, going back to the example that I did mention to you before about the mapping of palliative care research in Australia. So this is sort of something that I've used to think to map my findings. So I've had a graph about the number of publications, so total number of publications between 2000 and 2018, and I had a histogram showing the number of studies published in each year. I had also another graph showing the number of studies, whether it's quantitative, qualitative, mixed methods and reviews, and that was quite useful. I had another graph showing the study population. So obviously, one of my findings was that there wasn't many research done in children, and there wasn't many research done with carers. Most of the research was actually done in adults or patients. So it's really about being creative about how to present your results clearly so that it can answer your research question. And with palliative care, I was interested also in whether it was, what proportion of the research was done in cancer or non-cancer or not specified. So you can see it gives you a good way of being innovative about how you can present your results and having a good review, good publishable review at the end that tells you a good story that can address your question. So that's just an example about how you can map your results. So that's mapping sweetness. And again, this is actually presented in the methodology chapter that I've published with my colleagues. So you can present your results in any way you want. So this one was about mapping sweetness. So you can say here mapping sweetness and against and their effectiveness and their effect or effectiveness. So they wanted to know their effectiveness in losing weight, but also they wanted to know their impact on body weight, clinical outcomes, energy levels, energy intake, and so on. So they decided to use these crosses and see which studies have addressed which parameter in here. Now, another way, this one was again, the research question was to do with types of family involvement in intensive care units and identify the levels of involvement from being passive to active. So you can, so this particular paper, and I do have the evidence of it right at the end, so, and also it's in the JBI chapter, they decided to present it in a Venn diagram to present you the levels of family involvement in here. Another example. Sorry about that, I don't know why my screen freeze. Yeah, so another example is a concept map. Again, that's present also in the JBI chapter that we've published. And it tells you this is another way of presenting your results. You can present it as a concept map about where each of parameter is related to another. Again, that's another way of presenting your results. So don't be constrained by only just simple histograms or just you know, the tables that everybody else does, but think about creative ways that will make your scoping review publication interesting for readers as well to publish. In the discussion section, you only discuss the results and not state them, but also you discuss them in context of the current literature, any gaps in the literature, but you don't give any rating of quality. So you don't talk about it, because there's no critical appraisal, so you can't really say that was a good evidence, good quality evidence, or you can't really give any grading to this, and you don't use the grade approach for the presentation. In the conclusion, obviously the conclusion needs to match your review question, and you can include implication of the findings for research. So that's because obviously you are identifying gaps. So you can talk a little bit about further areas of research. You can also talk about findings for practice, but you can't talk about findings for policy because there is no appraisal in there. So this is the PRISMA, and if you are familiar with the PRISMA for systematic reviews, it does have different sections. It's got about 27 sections, and it tells you, it's just a checklist of what you need to include in a systematic review. For the PRISMA for scoping review, it doesn't have, it's got 7 sections and it's got 22 items instead of the 27. Because we don't include the critical appraisal, so some of the items have been excluded from the method section and from the results section. So that's so the 3 items that are excluded in the methods. So we obviously don't have the summary measures, we don't have the risk of bias, and we don't have subgroup analysis. In the results section, again, we don't have risk of bias and we don't have additional analysis presented in there, but everything else is present in there. Now, this is something that I'm currently working into advanced scoping review methodology. And so we're updating the PRISMA scoping review in accordance to the PRISMA 2020 update. We are also looking at the risk of bias tool for scoping reviews. So not all reviews are published to the same quality. As you know, there is an M-STAR tool for systematic reviews, and M-STAR tool tells you how good a systematic review is. So there is nothing for scoping reviews, and this is something that I'm working with at the moment with my team to work on what constitutes a good scoping review. And we're also working on updating scoping reviews on the conduct and reporting for scoping reviews. Just before I finish, I'd like to acknowledge my team, the team that I've been working with for the last 5 years on scoping reviews and advancing scoping reviews methodologies. That's just a list of all the references that I've used in my talk. And just my details, if you'd like to reach out with any specific questions, I'll be more than happy to help out. And I'm more than happy to help out with any questions at the moment too. So thank you very much.
Yeah, okay. Thank you very much for Hannah Khalil for your wonderful presentation. If I can make a point that I got from you, I think this is the interesting knowledge for us because you share about the concept of scoping reviews. I think not many people is familiar with the scoping reviews. Maybe everybody familiar with the systematic reviews. Okay, before we have a discussion in detail about the scoping reviews, I will invite the second speaker. She is my colleague, Dr. Inge Dhamanti, Ph.D. Okay, time is yours.
Hello. Assalamualaikum. Can you hear me clearly, Bu Laura?
Perfect.
Okay, then. Okay, thank you for the opportunity. I would like to share my screen. Okay. Oh, okay. Hang on. What is it? Okay. Let's try again. Yeah, yeah. Okay, can you see my slide?
Yes.
Yeah, okay, again. Okay. Good afternoon, everyone, and good afternoon, Dr. Hanan Khalil from Trobe University. First, I would like to say thank you for the Ppjpi Universitas Airlangga for inviting me to speak in this event. So I'm not a top scholar yet, so hopefully in the next few years. So therefore, I would like to just share about my experience in regard to publishing a manuscript. And the topic today is a bit different with Dr. Hanan. As I know, Dr. Hanan is the expert in the evidence-based public health because I'm still at the beginning stage, and I think this issue is important, but I thought that none of the speakers in this webinar series has brought this issue. That's why I would like to talk about the collaboration in scientific writing. Okay. A little bit background about myself. My name is Inge Dhamanti, and I'm a lecturer at the Department of Health Policy and Administration, Faculty of Public Health, Universitas Airlangga. And I did my study at Universitas Airlangga and at Trobe University. And my other affiliation is I currently have the adjunct senior lecturer appointment at Trobe University until December 2020. So this adjunct position is like an honor for me, and also it gives me access to the all university resources. For example, the library that helped me a lot in accessing recent articles. So it makes me easier in writing about the article. And my research interest is in health services management and patient safety and quality, but my age index is very low, so I'm not embarrassed to say that, but my age index is only 1 in Scopus. I only have like 5 publication in Scopus, and I have some more under review in Q1 Journal. And also, my Google Scholar age index is not better, it's only 2. But yes, I'm laughing at myself. But you know, the story behind the H index is, as we know that most of the Indonesian academics are struggling to write a manuscript, and for me especially, the challenge is to find the time to write, because I think with our heavy teaching workload, we have so many students to supervise, and also we do have some administrative tasks. So finding a time to read and to write is very challenging. So hopefully by the next few years, I could increase my H index, and I could be the one of the top scholars as the title of this webinar. So okay, so in this very good occasion, I would like also to introduce the research group where me and some other friends are working together and collaborating and focusing in patient safety. So the name is Center for Patient Safety Research, or Pusat Riset Keselamatan Pasien. So it is small research group. We just like 2 years old, and we want to contribute in improving patient safety through education and training. So that's our dream, but yeah, we have like a limited funding and etc. But currently we have like 3 research grants for this year, and also we also produce some patient safety education poster, as we know that the issue about patient safety is important, but you know, we're lack of awareness on the issue, and also the health worker has the same problem. And I'm also the reviewer in the Asia Pacific Journal of Public Health and Malaysian Journal of Medicine and Health Science, and Jurnal Kesehatan Prima from Poltekkes Kemenkes Mataram. So the outline for today is about the collaboration. So we will start with the definition of collaboration. Why do we need to collaborate, and essential element of collaboration? And then we go to the collaboration in writing and collaborating. This is the term that I found in the internet, is collaborating guidelines, some consideration, and some of my experiences in establishing collaboration. Okay. Actually, collaboration is common terms, and I'm pretty sure that most of us have applied collaboration in many aspects of our academic life. Either it is in the form of research, or in the collaboration in writing an article or a manuscript. So this presentation will cover the idea of collaboration in general, and also focusing in collaboration in writing. So actually, if we look at the definition, collaboration includes 2 or more people sharing complex information on an ongoing basis for a specific goal or purpose, or to achieve common goal. So collaborative environment includes commitment to mutual relationship. So the relationship has give benefit to all parties, and there is a developed structure. Usually this is a new structure because many people come into the collaboration. They come from different institutions or organizations. So we need to develop a structure to share the responsibility or share the tasks. And then usually there's a sharing of resources. And to make the collaboration work well, it requires comprehensive planning and also well-defined communication channels. So communication is one of the important thing that looks simple, but actually that's the key of working collaboration. And why do we need to collaborate? So if we, for example, I don't know about you, but I ever think sometimes, why do, for example, a professor with a very high H index, and then he still wants to collaborate with someone from LMIC, lower or middle income country, or someone who like me with don't have a really good track record publication, for example. And why do they still want to collaborate? Or maybe if we look at the trend in the research grant internationally, they require the partners in what the partners that are involved in the grant application to have a partnership with someone from, for example, developed and developing countries. So why do we need to collaborate? So there's an increasing move towards interdisciplinary research because there's a perspective that different people that come into the collaboration will bring different expertise. They have a different skill and better skill. They provide information, data, techniques, and tools to find solution to a problem, which is better if we do it together compared to when they try to solve the problem alone. And also, if we look at the health or area or the public health, the complexity of the research, healthcare, and quality of improvement make it very difficult to solve alone. That's why we need collaboration to solve the problem. Okay. The next slide is about maybe all of us are familiar with the story. This is about the story of the blind man and 6 blind men and the elephant. The story actually tells us about the need of communication and the need for respect different perspective. Also, there's a bias about the observation because this group of men, the blind men, try to describe the shape of the elephant, because they only touch like a one side of the elephant part, and then they try to make a conclusion from that one. So they came into a wrong conclusion. Actually, we don't want to use this perspective in solving the problem in our field or in the academic life. We want to have the full information and full perspective so we could come up with a better solution. So that's why we need a collaboration. Additionally, if we look at the literature, then this is from Journal of Hospitality Marketing and Management. So I tried to find something that related with the public health or health-related area or medicine, but I couldn't find it. So that's why I think this one is still relevant. So if we look at the authorship pattern, the number of publications with more than 2 authors are increasing. The trend are increasing rapidly. If we look at the green line, so this one is the highest one is the trend to publishing with the 3 authors, and the right line is the 2 authors. And the next graph is description about the publication with national versus international collaboration pattern. As we can see that in here, the purple line shows that 2 or more authors from 2 or more institutions and 2 or more countries are having the highest increase. So by look at this, we could see that there's a pressing need to do the collaboration, not only to get a better solution or recommendation, but also because it's required, for example, by the journal, or also it's required by the funding. So if we want to establish a collaboration, we need to look at the essential element of collaboration. So there are 7 essential elements that we need to maintain. For example, the first one is communication. As we know, communication plays important roles. Therefore, the ability to communicate effectively is critical. Open and transparent communication is encouraged, and it will influence the success of the collaboration. But we also need to aware on the barrier of communication, for example, social barrier or lack of understanding on the role, etc. The second one is trust and respect. We know that trust and respect are the intangible assets that knits the organization together. So trust is reciprocal, and trust is the key to maintain a good relationship. The third one, equality and power. So it is expected that in a good collaboration, our collaborative partner will be and should be have an equal confined to the project, equal role confined to the project. Within partnership, when we work with our partner, we need to have a set of common goals. We need to have understanding of the level of the required commitment to do a collaboration. And also within incentive and value, for example, we could take something from the collaboration that we value the most, and we use that as an incentive for ourselves. For example, if we highly value the collaboration working with the professor from overseas, because we know that it will give us a lot of benefit. For example, we know how usually they, for example, how their perspective in solving or looking at the problem, and there could be a transfer of knowledge or transfer of the skill during the collaboration. So because for example, because I value that the most, then I take that as an incentive that it will become the motivation for me to do that collaboration. Negotiation, yeah, it happens a lot in the collaboration. Sometimes we need to compromise on the roles and the responsibility, and also there's a knowledge sharing between or within the collaboration. Okay, next I'm gonna move to the collaboration in writing. So when we talk about the collaboration in writing, we couldn't avoid the discussion about the authorship. So actually, who is the author? So an author is defined as the one who begins or creates, or the one who starts a plan or an idea. So for research publication, an author is generally considered to be someone who made substantial contribution to a published study. That's the author. So why authorship matters? And actually, authorship is a bit sensitive issue, I think. Maybe in developing country, because of some of the culture and other things who could influence authorship. Why authorship matters? Because it transfers credit, and from the credit we could use the credit for performance appraisal or for the promotion to the higher position within our career. And also it has important academic, social, and financial implication. The example of financial implication is when the authorship from the for example, if we get the patent from the published manuscript, and also, for example, if we use the manuscript as a base for applications for a new research grant, that could give financial implications. And also, authorship implies responsibility and accountability for published work. So, authorship is associated with recognition of creativity, creation for new knowledge, and new solution or novel insights. So, however, there are some issue with the authorship. Therefore, some journal request and publish information about the contribution of each person who mentioned in the authorship. So, for example, if we look at the International Committee of Medical Journal Editors, they recommend that the authorship should be based on the following 4 criteria. So actually, ICMGE is a small working who meet annually to develop a recommendation, and they are, for example, and their members are some of the high reputable or high ranking journal. For example, in here is the British Medical Journal, Bulletin of WHO, Journal of American Medical Association, The Lancet, and some other high index or reputable journal. So, according to this small working group, author is someone who provide or give substantial contribution to the conception or design of the work, or they help in acquisition, analysis, and interpretation of data. And in here, we need to highlight this and also they provide, they help in drafting the work or revising it critically, and also they approve the final version of the manuscript, and also they agree to be accountable for the published manuscript. So according to ICMGE, author is someone who fulfill all these 4 criteria. For example, there is someone who helped us in doing only one of the criteria, then they should not be listed as the author, but they should be mentioned or put in the acknowledgement. However, in practice, not all journal following the ICMGE recommendation. So if we look at the benefit of the co-authorship, so there are so many benefits of the co-authorship. Say the potential benefit increase in productivity. So if we look at, for example, the number of manuscripts published in our department or in our faculty, co-authorship will help improve the number of the manuscripts produced every year. And also it provides mentoring opportunity. I took a lot of the advantages from the mentoring opportunity during my Ph.D. Study, or even after my Ph.D. study, because I think maintain a good relationship with our former supervisor is very important. And I'm so lucky that I have 2 supervisors that are really supportive and help me even after I finish my study. And then sometimes I come with some idea about applying a grant or writing another manuscript. They will happily support it. And also sometimes from them we could extend the relationship or the collaboration. For example, how I get introduced with Dr. Hanan Khalil is through extended collaboration, because a few months ago I wrote to my professor. I told her that I would like to updating my skill in conducting systematic review, and then I came up to an idea to do some systematic review, and then she invited Hanan into the team, and I do appreciate that and have value that one, because I know that Hanan has a really strong skill in conducting systematic review or literature review. So that's kind of the extended collaboration that we could get from maintaining a good relationship with not only with our supervisor, but also with other colleagues. So co-authorship and also over professional development and collegial networking. Working with others can increase ideation level, yes. For example, if you realize that if we do the brainstorming with someone which is really smart, we can just like amazed in how many research topic that would come up from the 30 minutes of brainstorming. And also the third one is other strengths can compensate for your weakness. I think this reflects me a lot, because I have an experience in conducting mixed method for my dissertation. However, I'm not confident with the quantitative one. So when I do some collaboration with some other friends, so they will cover my weakness and I'll do the same thing. So they will do the quantitative analysis, and while I focus on the qualitative data. And also the fourth one is breaking out the silo of our department or college. Yeah, I think in public health, usually we understand that the public health issue can only be solved if we work multidisciplinary, but sometimes it is very hard to make a collaboration because of the silo between the department. The last one is about it allows faculty members with less experience to learn from those with more. And also it could broaden, sharpen, and deepen someone's disciplinary knowledge and reinforce teamwork, critical thinking, and also give us chance to build professional network and also stronger submission, yeah, because it cited that collaborative manuscripts are more likely to be accepted in journal, and also it has higher citation rate, and also presumably it's reflecting higher quality and impact. So collaboration is once again is very important, and also it improves funding opportunity. So, however, there are some authorship issue when we want to do the collaboration in writing, and these two issues I think are common. And the first one is honorary guest or gifted authorship, and the second one is ghostwriting. So, what's the honorary authorship? Actually, honorary authorship could be defined into the first one is guest authorship, and the second one is gifted authorship. So, guest authorship is the authorship that is bestowed upon individual who have not made any contribution for the paper. So why the author do that? Because there's a perspective that the prestige of the guest author yeah, could improve the chance of getting accepted by the journal. So, for example, if we put Professor X in our manuscript name with his approval, but the reality is he has not contributed to our manuscript. So we just think that we put his professor, and also it will be recognized by the journal, and it will increase the chance of getting published because he already has like some track record in publication. While the gifted authorship is usually given to lower academic rank or those who have fewer publication in the department or in a faculty. So the prevalence of guest or honorary authorship is to be at 11 until 60% is quite high. So articles with over 5 authors are more likely to have honorary author than those with 3 or lesser number of authors. And the ghost authorship, or we could say is a ghostwriting. Ghostwriter are those who participate in research, data analysis, and writing a manuscript, but are not named or disclosed in the author as the author or in the acknowledgement. Usually, this is refer to students who contribute to the writing or the author personal editor. So actually, to solve this problem, we need to check whether, for example, if the student, whether they contribute to the 4 criteria of the author that previously mentioned. If not, then they could put their name in the acknowledgement. The same thing with, we could do the same thing with the personal editor. Okay, so inappropriate and article authorship persists. Yes, if you look at the numbers, like 21% among the 630 articles in 6 medical journal reported of the unethical authorship, and 42% of articles in nursing journal had at least one author who did not meet the authorship requirement. So why this is important? Because as an early career researcher, we need to have a good integrity, and we need to build a good integrity. And because this authorship issue are unethical and dishonest, so we should try to avoid them. So because we want to give a acknowledgement to the proper person who do or who involved in the manuscript development. So all journals discourage this practice. That's why in many journals they have this like a revision of the author, and we need to explain whether the first author, the first and the second and the third one, what are their contributions. So this is just a simple guideline. So if we want to establish the collaboration, we already know what are the important elements and what issue that we need to avoid. So if we want to start to make a collaboration, the first thing that we can do is first thing is find collaborators you respect. So it means that we could find someone who we think has the same value, the same passion, and we start from there. And we need to establish the roles early. We need to explain what are the expectations and what are the other co-authors, for example, contribution. We need to establish a goal and time frame. We need to do some market research by looking at which journal that we want to which journal that we target. We look at how many words that we need, and we look at we read the instruction for author and etc. And number 5 is we need to listen carefully to your collaborator and take notes when they speak. I think this is a part of the learning, because based on my learning, we will get so many idea or so many new things if we listen and we take notes. So this back again to my wonderful PhD experience. So yeah, I learned a lot from both of my mentors. But then take notes is really important, because I'm not like I know maybe many people nowadays they use laptop or tab, yeah, but I prefer to do it traditional way. That's why in here I have so many pages of writing, because when I do writing, when I move my hand and start writing, it somehow it makes my brain work compared to just typing. So yeah, take notes is important. So listen with real intent to understand and try to make connection. And sometimes we need to try to look with different perspective on the collaboration, because as we need to remember about the story about the elephant of the 6 blind men, where they have a different perspective, but in the end they don't want to listen to each other, they don't respect other people's perspective. So in the collaboration, sometimes we need to put our ego away and we need to listen, because the main aim in here is we learn something, and that's the important role within a collaboration, is respecting and learn something. Finish the place means that when we have the manuscript, and then we need to decide who gonna do the manuscript submission and etc. Some when establish a good relationship, to establish a good collaboration is the first is to establish and maintain good relationship. This is very important because from a good relationship we could have so many opportunity of other collaboration that's coming, and also we need to draw a plan. I believe that each of us have like a vision or a goal, and we could not, if I could say, we should not say yes to any type of collaboration. That we need to have a priority. We need to have like certain criteria. For example, if the collaboration will support my expertise, and then I will say yes and I will commit to it. But if the collaboration is important, but it's in the different field, maybe we could think about that and just need to focus on what become our vision. I think that's important for the early career researchers because we need to build our expertise. And by the end of the day, we want people see us as someone who being consistent in the certain areas. I think draw a plan is also important. And lastly, communication. Communication is primary thing and essential thing in research collaboration. So we need to open and transparent and honest. And some experiences, I don't know whether this is useful or not, but I decided to discuss it in here. So this is my first journal that I submit, my first article that I submitted in the journal back in 2018. So the journal is a journal of patient safety. When I submitted this manuscript, the journal rank was in the Q1 focus. But there's I think there's a problem with the journal because I hear no, because I remember one of the emails said that there's a backlog in the journal publication. That's why it's almost take 2 years for me to get this article published. And when it's published, the rank was down to the Q2. But I'm still happy because this is a journal of patient safety. And this is actually a part of my dissertation because my dissertation the study was quite big, where I do a mixed method study, and the survey is involving like 1,200 health workers, and also the total number of the organization involved is 16 organizations. So I do many interviews, and this is only actually one small part of the dissertation when I compare the patient safety incident reporting system in between Indonesia, Malaysia, and Taiwan. But then because I think the issue is important because in Indonesia, not many national level or international level, research published in the area of patient safety or patient safety incident reporting. So in here, actually when I did a lot of research about the system in Taiwan and Malaysia, but then I feel that I'm the outsider of the system. I don't know how the system actually works because I only look at the literature and also the patient safety organization website. Then I decided to contact someone who I think has the knowledge in the patient safety incident reporting. So I contacted, this is Ms. Liao from the Taiwan Joint Commission. And this is Ms. Ibu Norsia from the Patient Safety Unit in Ministry of Health of Malaysia. So both of the organizations are handling the incident reporting. So how they contribute to this manuscript is because some of the publications, especially from Taiwan, are in Chinese, and I don't understand Chinese, even though I try to put them in the Google Translate. So Ms. Liao helped me to supply the document that I need to write in here. The same thing with Ibu Nursea. However, the Malaysian system one are a bit better because they have almost everything of the publication are in English, so it's easier to understand. And also when I need to do revision of this manuscript, they help me with providing the newest incident reporting data. So yes, this is my first experience actually about randomly asking someone to contribute as a co-author in my paper. And this is the second one. This is the second one. The second one is about still about incident reporting, and also this is only like one part of my research aim. So in here, I collaborate with the professor from UK, which because of this article, I got the grant from the travel grant, kind of travel grant, to travel and stay in London for 2 weeks to establish more collaboration with academic in UK. So these were example, and this one, and also the message from this one is what I want to say. We could find any opportunity to do a collaboration. So it's with this one, this PEER. So I tried to apply for this grant twice, yeah, but it was not successful because of the application that I submitted. But the first step is I need to find partners from United States. So at that time, I tried to contact I think 3 or 4 different academics and ask them whether they want to collaborate to apply for this one. The first year, I failed on the first year because I don't get any partner, which means I could not apply for the grant. And the second year is the same thing happened again. And then I switched my strategy. So I applied for the Fulbright Specialist Indonesia, where Fulbright, I mean, if they'll connect me with someone with the Fulbright Specialist from the United States. And the application was under the research group name. And luckily we get one connection with the professor from Johns Hopkins University. So finally, I have someone, or I have a connection and collaboration from United States. And the last one, the last one is, for example, if you are currently studying overseas, and I think it's a very good opportunity for you to establish a collaboration while you're in Australia, not in Australia, in your country where you're studying. So, for example, with my experience in conducting the postdoctoral short-term study, so I did a research by interviewing the representatives from the Australian Patient Safety Agency from 3 different states, in Adelaide, in Melbourne, and also in Sydney. So by interviewing them, I start to make connection. Most of them are really nice and friendly, but only a few of them who expressly show their interest to establish a collaboration. So that's from there, we move to the grant application. That I applied like 2 years ago, but you know, failure is part of the process. So we fail on this grant application, but the collaboration is still open, and they say that maybe we could try to do collaboration in other forms. So I think that's all for my presentation. So what I want to say is, establishing a collaboration is important, and there are so many ways that are available. For example, if you want to establish collaboration with overseas partner, and the thing is how we manage the collaboration is another important chapter from the collaboration. I think that's all, Bu Laura. Thank you so much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much for Dr. Inge. Very interesting and nice presentation, because Dr. Inge said about a lot of collaboration miracle. That's right. So I think even Dr. Inge said that she has not expert for the publication, but as I know that she has doing many research and got some grant, and also she has many collaboration right now. So I think this is the good initiative started. In the future, maybe she can produce many publications. Yeah. Okay. Just maybe I also can get the one point, yeah, important point thing from her explanation, from her presentation. She said that the collaboration is important to do research. I absolutely agree with her because we need many experts, look for the mentors and etc. So we can complement each other. So because, yeah, of course, we have a weakness in this field, and maybe other person has the strength for that field. So we can complement each other. Okay, just reminder for the participant, all of the participants still can give the question. Please, you can write down in the chat rooms, even in the Zoom or live streaming YouTube. We still waiting for all the question today. I think we have the outstanding presenter, outstanding speaker. So maybe all of you can have a lot of question. Okay. So I have collect the question from the Zoom chat room in Zoom. Wait the moment, I will share screen. Can you see the screen? Okay, the first question to Prof. Khalil. This is question from Ike Purnamasari, International Islamic Uni Malaysia. So she is from Malaysia. Her question is, Prof. Khalil was mentioned previously that scoping review cannot do to policy recommendation because they do not have critical appraisal. So why, and any suggest review method for publish some policy or model such as developing conceptual or framework? So please, Prof. Khalil can answer this question. Thank you. Your voice still okay.
Yeah, thank you very much. Look, what I meant to say is that scoping reviews, because you don't have critical appraisal, you cannot grade the evidence. So you can't say that this is high quality evidence or this is low quality evidence. So it's really hard to give guidance to policymakers about how the findings can influence their policies. However, you can use scoping reviews to do a conceptual or framework, to develop conceptual framework. So what I would do, I would use the scoping reviews to develop conceptual framework by doing a scoping review, and you need to think about maybe in presenting your results can be done in a sort of by mapping your concepts and see how the concepts are all related to each other. So once you do the scoping review, if you want to develop a conceptual or a framework, you can do scoping review, map your results, but then also you can create a flow chart out of this, and you can write a narrative, and then you can produce a conceptual framework from this. So scoping reviews are good to develop conceptual frameworks. It's going to be based on how good your research question is going to be, and how you can present your results in a sort of using a concept map to relate all the findings together. So that's the first question. So you can definitely, from a scoping review, when you present your finding, you can inform practice, but you can't say this is high quality evidence or this is low quality evidence, because you don't do critical appraisal in there, but it can definitely inform practice. And that's why you can't inform policy, because you don't put a grading on the evidence that you're generating in there. So I hope this is clear. Regarding the second question, with somebody said that systematic reviews are easier, scoping reviews are easier to do than systematic reviews. Look, I've actually published the paper. I've published the paper about the length of time that people take doing scoping reviews, and it ranges between 3 months to 12 months. So it can be quicker. And the reason why it's quicker, because you don't do the critical appraisal. You don't go through all the studies and make sure that they, look through the risk of bias and all of that. So theoretically it is quicker. And I've done scoping reviews in 2 months' time or 3 months. So it is doable to do it in a shorter time. Thank you.
Okay, thank you, Professor Khalil. You also answered for the second question. Thank you very much. And the next question, because still don't have any questions so far. So can I ask to Dr. Inge? For example, if we want to have the collaboration, but we don't have the collaborated right now anymore. So what is your suggestion? Thank you.
I'm sorry, I didn't get it. What's the question again?
Yeah. For example, someone want to have the collaboration, the research collaboration, but unfortunately, they don't have the collaborated yet right now anymore. So what is your suggestion for them? Thank you.
I think based on my experience, it is not difficult to get someone who wants to collaborate with us, because if we look around us, we have so many different groups, like a WhatsApp group with a focus on, like for example, for the academics, and also we have the connection with other researchers. I think it is not difficult. So, for example, what I did when I established the research group is I send like a open announcement, or like a short announcement that I'm looking for someone who has the same interest or the same passion in patient safety. So for example, like that, and then I send it to other faculty, and then it came up with some college who saw that they do have really the same passion with me in improving patient safety. So what I want to say is there are so many different channels that we can use. For example, if we have like a connection in Universitas Indonesia and other universities, we could just ask who is the one who has this expertise in the university and try to get their contact and whether they want to collaborate. And with lecturer in overseas, actually we could use the channel from someone who already finished studying from overseas, or we could like asking someone who is currently studying, because they will know who are the lecturers who has like the same interest, and we could start, for example, we in what terms or in what kind of collaboration that we want to offer, whether it's reviewing our manuscript, or maybe we want to start a project together. Sometimes it fails, or maybe it fails a lot, but the thing is we just need to try and try over and over again. Maybe something like that, Bu Laura. Thank you. Or maybe the Dr. Hanan could adding something. So, for example, like this one, what is your consideration when you get the offer from someone that you don't know the report? You just know, you just read the email, you just know the name, and when you try to Googling, you don't have any publication track. So what? I mean, the person who contacts you doesn't have any publication track. So actually, what you do with this kind of person, based on your experience?
Thank you, Inge. Look, making collaborations is very difficult and it's challenging, even for established academics like myself. It's still hard to do that. And in a collaboration, you don't want everybody to be the same. You want to have somebody who's good at statistics, somebody who's good at writing, somebody who's good at maybe coming up with research questions, somebody who's good at data analysis, and so on. So you don't want everybody to be exactly the same. Otherwise, they won't be adding a lot to the collaboration or to the team. For me, I'm very open, I have to say. So when somebody comes in and asks to be a collaborator on something, I'm more likely to say yes than no. I don't like to have this prejudgment. For me, writing a paper here or there, it's not, it's not difficult for me because I've been in that process for a long time, and I do help. I like to help my students, and I like to help other people. I've managed at the moment, since Sandy has left, so I manage a team of about 5 or 6, and some of them are junior researchers. So we try to come up together with some common research questions so that all of us can work together. So I think it's really about having expectations, and normally I really believe that everybody can contribute somehow to a team. You don't have to be good at everything. You don't have to be good at the things that I'm good at. Otherwise, you won't be contributing to a team. So this is how I look at it. I'm very open, and I do hope some of my colleagues are the same. But when you do a collaboration, you don't have to think about this person is going to do exactly the same work as me. I think we probably need to be a bit flexible about our expectations about what this person can bring into the teamwork. I don't know whether I've answered your question or not.
Yes, thanks a lot.
Okay, thank you very much for Dr. Khalil and Dr. Inge for the answer the question. So the next question, this is related with the hot issue. I think he asks about the why prediction about the COVID-19 in Indonesia has any effect with other disease. So all of the speaker can answer this question, because I'm not sure this question to be addressed to to whom, but I think maybe Dr. Inge can answer first. Thank you. Maybe also Dr. Hannah can compare with the Australia situation. Thank you.
I think if I look at the question, this is more to epidemiologic question, and you are the one who has the expertise in answering that one, Bu Laura. You are the epidemiologist.
Okay, or maybe we can hear the situation of COVID-19 spreading in Australia. Maybe more interesting.
Yeah, sure. I can talk about Australia. So I live in Melbourne, and Melbourne at the moment has got stage 4 restriction. So at the moment, we're probably the worst state in Australia. All the other states have got probably a number of active cases in, say, 20, 30, under 20. In Melbourne here, we've got today, it was cited to be 113 active cases and 24 deaths, this is a significant number of deaths compared to what we've had in the past. It doesn't look like it's much compared to other countries. I think we are in the second wave now. This lockdown, stage 4 restriction is supposed to be finished in mid-September, but the government now is talking about extending beyond mid-September a bit further to reduce the numbers. So as you know, with the growth of cases, it's exponential. And with 4 weeks ago, it was 700 cases. And that's why the government declared a state of emergency. And they decided that we need to have a stage 4 restriction. A stage 4 restriction means that you can only go out to buy grocery or to go to the doctor. Only one person from one household goes to the shopping, and we have a curfew at 8 o'clock. So no one is allowed to go outside beyond 8 o'clock. This is very different to what's happening in Sydney, Adelaide, all the other states, just because of our high numbers. Now, there's a lot of research that's been done and being published at the moment about COVID. Now, what I'm hearing is that COVID-19, they say we do have a different mutation, a different strain now to others. So people are seeing different strains, or maybe 1 or 2 strains. People are also seeing that there is long-term effects of, some people are actually getting affected by the virus. So it's not just the 2 weeks or that you are sick and just getting better after this, but some people are actually losing the sense of taste. Some people have got a sense of being tired all the time. So it's only now we're learning about the long-term effects of COVID and what this means to us. It has certainly put a lot of strain on our health system. We don't have a lot of beds when it comes to ICU, intensive care units. And that's why the government has put a lot of restrictions on people moving out and mixing with each other, because we don't have the capacity to deal with this many people if they get sick and go to ICU. So I guess long-term and chronic disease and relation to other diseases, it's too early to know. I get worried personally about the effect of the vaccine. So people are, as you know, when new drugs are getting developed, including vaccines, you need to, things take up to 5 years or, 3 to 5 years to know the long-term effects of these vaccines, not just the good effects, but also the adverse events. So as much as I would like to have a vaccine as soon as possible, but I'm worried about the long-term effects of these vaccines, because we don't know what's going to happen for these long-term effects. And the government now, some governments are saying that it's going to be mandatory for everybody to have the vaccine. Well, I'm not quite sure about the long-term effect and the side effects of these vaccines. And it's not really fair to make it mandatory for everybody, because you do need the time. There is a good reason why you need 5 years to develop any new medication or any new vaccine for this. So that's what I know. That's what's being out in the literature. I know that lots of surveys are being done now about, coping mechanisms for nurses and health professionals in general in COVID. Lots of of research is being done about, you know, what's out there and all of that. So just watch the space. I think it's such a very new evolving area. But I can tell you the situation in Australia, it's everywhere is fine except in Melbourne. And it's just watch the space. But this is definitely our second wave, and it's the highest number of cases that we've been recording in March. Like in March, it was like the most that we've recorded, maybe 100. But second wave now in June, July, the most that we've recorded is 700 and something, 750. So which is huge for us. Happy to answer any questions, or happy for Inge to add anything. But yeah, it's still evolving, I think. Thank you.
Okay, thank you very much for Prof. Khalil. So maybe Dr. Inge wants to add some statement about the COVID situation. Maybe in the hospital, how is the patient safety in a hospital related with the COVID spreading?
I think that will be a different issue if we look at how COVID-19 affecting patient safety, but I think it's not much change in the mentioned in the literature right now, but I don't know about recently because I haven't checked the current literature regarding COVID-19 and patient safety. But what I look is the difference between the government response in Australia and Indonesia is very, very different, because I did some of the research about the Australian government policy like a few months ago when the pandemic just started, and I see how the difference about the containment of the cases that happen in Australia. And in Indonesia, I don't know the number of active cases. Yesterday, is it more than 150,000, right, Bu Laura? Around that one, 150,000, and the daily cases is more than 2,000. But as you see, as we see in the media or everywhere, there is no restriction, so people can go anywhere, and sometimes they wear masks, but they don't do the physical distancing and everything. So they put a lot of burden to our health services, because so many sick people will come to the hospital, and as you know, the number of the medical workers that die because of COVID-19 in Indonesia is the highest in the world. So what we say, so this is totally different. So this is yeah. So sometimes I just so envy with the one who lives in Australia because the government do different things. So yeah, maybe just that one, Bu Laura. Thank you.
Okay, thank you, Dr. Inge. Still have one more question about the COVID, but I think maybe this topic is not related with our webinar today's. So I think Ppjpi should think about this topic later for the webinar series. So, okay.
Thank you. Just before I go, can I just add something? If you are interested, if you are interested in joining a scoping review website to get to know the news and topics and all of that, I can just put a link in the chat for people if they want to join in and have some news in there about
of course. Thank you.
Thank you.
Yeah. Thank you very much.
Okay, thank you. All the best.
Okay, because we don't have any questions so far, so we can finish our webinar today. Thank you very much for Dr. Hannah Khalil. Nice to meet you.
Likewise, thank you.
Dr. Inge, thank you very much for a nice presentation. So we hope that this webinar will be useful for all the participants who are joining this webinar. So for the participant, you can fill in the attendance link in the chat room in Zoom, and you can get you will get the A certificate. Okay, thank you. Thank you very much for the participant also for joining today. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Okay.
Bye-bye.
Bye bye. Thank you.